Hi, this is Kevin, kinesiologist, personal trainer, cardiac rehab. Just some exercises you can do in lying down, supine, in your bed. This is specifically for stroke patients, people who have difficulty sitting in a chair, standing. Just some stretches you can do to help with flexibility, especially if one side is affected more than the other. The important thing is being able to practice moving that side throughout the day. We're talking about hundreds of repetitions throughout the day. I will show you a circuit you can do from the head down to the toes, and we're going to repeat each exercise 2 sets of 10. Again, if these exercises are helping you just regain movement in your affected side, then you want to do it throughout your day, not just 2 sets of 10. You want to be able to do that up to 100 repetitions throughout your day. So maybe 10 reps each hour. And that's the only way the brain's going to relearn that movement and get you moving again after a stroke. So we'll get started. So let's say you're laying down, maybe in the morning. Either right side or left side is affected. We're going to start from the head going down. So the first one is the neck, seeing if you can move your neck over one way into your middle and then your other side. So the neck rotation shouldn't be too fast, should be controlled. Feeling that tightness around the front of the neck on the side you're moving towards, and a stretch on the opposite side. So here I'm just counting 10. That's the first one, neck rotation, to help you look up, down, or to the side. Perfect. That's your first set. You take a breather. When you're ready, you go into the second set, still counting 10, neck rotation. Always breathing in, breathing out. If you find it's painful to move the neck, then you don't have to move it as far, especially on one side than the other. As long as you're promoting some movement, some days will be better than others, so you do what you can. The next one is the shoulders, so shoulder flexion. You start with one side lifting up. So level 1 would be just lifting up medium. Level 2 would be straight in front of you. And level 3 is reaching all the way behind you. So I'm going to show a full range of motion here. You can do any range that is comfortable for you. Feeling that in your front shoulder muscles. That's called shoulder flexion or shoulder front raise. Feeling that in your front shoulder or anterior deltoid muscles. Still, I'm aiming for 10 repetitions or as much as is tolerable for you. And then you'll switch sides onto your other side. So even if you cannot move your affected side as much, still try as much as you can. And if you can only move your unaffected side, then do that. There are studies that show that if you can move one side, you can still get those brain pathways to work on your other side. With stroke patients, we're not so much training the muscles, we're training the brain. So there's your first set of 10, and then you take a breather if you need to. You go into your second set. Shoulder flexion for your front shoulder muscles. You use these front shoulder muscles whenever you push a door, put your groceries on the top shelf, carry your grandkids, or carry tools close to your chest. Then you switch to your other side, aiming for your 10. Again, any range of motion that's comfortable. If you can only go halfway, only go halfway, and that's fine. Yeah, so you want to count 10 repetitions there. Perfect. The next one we're going to go into is a palm up, palm down. Level 1, going into palm up and palm down. So I'm showing it elevated, but you can also do it from the bed. Palm up and palm down. And it can be with your whole arm laying on the bed. So then I'll do the other side. Palm up, palm down. This one, sometimes people do it and they just move the forearm. You want to move from the shoulder. So a full palm up from the shoulder opening up. And you should feel that stretch in your front shoulder chest and tightness in your shoulder blades. Training your shoulder blade muscles will allow you to sit taller in a chair and will prevent a slouched posture people get when standing or seated after a stroke. That's level 1. I did my 10 repetitions each side. If that was comfortable, stay with it, do a second set. I'm going to show a level 2. That's with the arms in this 90-degree position. And you're going to open out wide and come back. Still rotating from the shoulder. Feeling that stretch in your front shoulder chest and tightness along the side of the shoulder into your shoulder blades. So this is external rotation of the shoulder, using your rotator cuff muscles or your shoulder blade muscles. You aim for your 10, then you go to your other side. Again, if you cannot go as far out on your other side, that's no problem. Do what you can, feeling that along your shoulder muscles. If any of these exercises cause you pain, don't do them. It is important to practice stretching neck, shoulder, upper back, hips, and ankles, because those are the ones that we move the most in our day-to-day life. Walking, balance, stairs, chores around the house, and there's the 10. The next one we're going to do is for your core muscles, so stomach, low back, hips, and shoulder blade. That is what core is, everything except your limbs. For this one, all you're trying to do is roll over to one side, come back into the middle, and roll over to your other side. So again, if you have an affected side and you can only move towards one way, just move towards that one way. Over time, as you practice these exercises, your brain will relearn the pathways. I'm showing 2 sets of 10. So this would be 7, 8, 9, and 10. But in order for your brain to relearn, you have to do this. We're talking about repetitions in the hundreds. So a good place to start would be to do this laying down routine 3 times in the day. Breakfast, lunch, dinner. And slowly adding more types of repetitive exercises for the affected side throughout the course of the day. So then we repeat that for a second set. Turning. This works your stomach, your low back, your shoulder blade, and your hip muscles. And then last ones. Great. Going down into the hips, the next one we do is called a heel slide, where you want to slide the heel close to your glutes and then slide down. For people that have knee pain, they won't be able to bring their heel all the way into the glute. So you do as much as you can. You'll feel that tightness in your quad muscles and hip flexor. So deeper underneath your thigh are your hip flexors. Because this motion is called flexion in fitness. Same, you'd aim for your 10, then you do your other side, sliding and coming back. So it's called a heel slide for the same thigh muscles used as getting up from a chair, single leg balance, getting up from gardening, or climbing stairs. Heel slide. There's my first set of 10 both sides, and then we go on to your other side, going back and forth. And then you'll switch sides. Counting your 10 for your hip muscles. The second one we do for your hip muscles is called a clamshell. So different options here. So just to show my feet. So let's say you're lying down. So lying down, I'm just trying to show my feet. We go into what we call a clamshell, where you open wide and you bring back. Open and bring back. So imagine you're lying down and you're trying to move your legs out and bring them back in again for your glute muscles. That's level 1. So you would do this lying down, not seated. I'm just showing you so you can see my legs. Option 2, if it's comfortable for you to get into this thigh and hip position, you bring your feet close together and you open and close. That's called a clamshell. Stretching your front or inner thighs, adductors, inner thighs, and strengthening your glute muscles, your outer thighs. And we use glute muscles, especially if there's hip stiffness, low back stiffness. But hip or glute muscles are used the most when you bend down to pick something up or gardening, when you use your stairs, walking up or down, and on the up portion of getting out of a chair. Clamshell. So you can either do with feet bent, if you can with your body, or legs down and you open and close. 2 sets of 10, whichever one feels better for you. And finally, the last one we go into is for your ankles. To help with balance and preventing falls, we need to have flexibility in our calf and ankles. So this one's called an ankle pump. So I'm doing them lying down. The camera cannot see, so you would still do them lying down, but so that you can see the motion. Ankle pump, like if you're doing pressing on the accelerator. So you would do that lying down, counting 10, feeling the tightness in your shin or lower leg when your feet come up, and then tightness in your calf when your feet or toes go down. You do 10 one side, 10 on the other side. breathing in and breathing out. So you would do that lying down. So lying down, it would look like this. You just can't see the ankles. But you would do a set of 10 each side to help you with driving again, especially if they've taken away your license because of the stroke. But to also help with ankle flexibility so that when you walk or stand, you can improve your balance and do those activities for a little bit longer. So that's a full body routine that you can do laying down. Um, if you have any questions about the exercises or modifications, you can comment on the page. Mm, Besides that, try them out. I'll also make a chair version of stroke exercises or stretches you can do to promote flexibility. Again, Kevin here, personal trainer, kinesiologist. Have a great day.